It's Dr. Yazdan. We've been getting a lot of questions in the last, call it 2 months, about do I have to be on finasteride if I have a hair transplant? And it's a great question. It seems like it's kind of like the new internet buzz because a lot of online inquiries and a lot of people that I'm talking to are asking this. So here's my take on it. Generally, I recommend medical management for all of our patients that come in to us for a hair transplant. Now, medical management consists of a multitude of things. It's not just finasteride. There's a lot of other modalities for medical management, and usually I go through that. I tailor a program for patients, and then that's what they do. Now, the question of do you have to and is it mandatory? In most patients, it is a good idea to consider being on finasteride post hair transplant. But some patients just say, well, look, you know what? I don't want to be on an oral medication. I don't care about what anyone says. I just don't want to take it. I don't want to do it. And it is what it is. Well, in that patient, then it's not a requirement. You know, there is other medical management we can do. There is the understanding that, you know, if I'm not on medical management, my hair is going to get worse. But if we fill things up with a transplant, it's going to be better than what it was without a transplant. And, you know, there's different ways of looking at it. Sometimes you also get guys who've just lost a lot of hair, and finasteride isn't really going to do anything for them. So why is that patient supposed to be on finasteride? They may not really benefit from it much at all. So I think that the question is really patient dependent. It really depends on, you know, what the patient's beliefs are. Are they going to really take an oral medication every day? Are they even a candidate? Is it going to work for them? And, you know, whether they're going to understand that they want to be on it consistently long term. But, you know, ultimately, the answer is yes, you probably should be on finasteride, but if you're not going to be, it still are avenues where it's okay. And so, you know, this is a discussion that I have with patients. I spend a lot of time with them, and I'll go over all the medical management. We'll put a program together for them, and, you know, they usually do that, and we follow that up, and it tends to do pretty well. If you guys have any questions about medical management, reach out to us. I'll be happy to chat with you guys about it.